Hi, my name is Laylane Chagas. I'm a physiotherapist, and in this stretching I'm going to show you how to work more on the muscles that goes into the lateral aspect of your trunk, especially the Quadratus lumborum muscle, or is family called the QL muscle. And if you're having some pain in your flank area there, or tightness deep in the spine, that feels like it's like your kidneys that are hurting, that's a good stretch to try. You're going to start with the position of lying down, and we're going to do the X stretch first. So you lie down on your back, just position yourself in neutral. Then you go on a side laying position. Make sure you're supporting your head well with your arm, and then you are going to straighten up your legs. And then you are going to start with the X. The fulcrum of the X will be your waistline, and then you can start by doing one arm of the X. That will be moving the leg forward and your arm in the opposite direction. So you have one arm of the X, and you really work in turning your hip away from where your shoulder is going. So you get that deep stretch onto the waistline, and then you try to position your leg in as if you're trying to grow your leg longer. So you take your hip away while you bring your arm to the opposite direction. And from here, you just try to do a deep exhale. So that should stretch some muscles there in your back. If you're feeling a lot of pain or stretching in your armpit, you're welcome to just fold your arm and let the elbow bend, and then continue to stretch. You should stretch a lot your biceps muscles there. And then you would move on after 2 to 5 cycles of breath, depending how much relaxation you want to put on. You're going to move towards the other arm of the X. So now the leg is behind and your arm is in the front, and you're just trying to reach forward while you try to grow your leg into the opposite direction. So you're going to be twisting that flank zone there, the waist, into the opposite direction. So you just move your hip away from your shoulder, and you try to grow in opposite directions there. And from here you do a deep exhale, allowing the ribs to relax, and that may give you a little deeper stretch. So coming back in a neutral position. A variation of a stretching position to also target the QL, the Quadratus lumborum, or the muscles on the side that does lateral flexion on your trunk. You can use the mermaid posture, the mermaid stretching, which is basically sitting down, trying to sit as straight as possible on your pelvis, sitting on your sitting bones, the 2 lumps in the glute area there. And then you just move the knees and the legs to the lateral position. That's why it's called the mermaid posture. So from here, depending on how much flexibility you have, you can start there straight away. If you're having a hard time to position your legs in that way, you cannot settle down with your knees because of tension in the hip area, you can always use a prop to set yourself a little bit higher up. So you're going to be sitting on a cushion or anything a little bit harder there, and that may allow you to have a little bit more comfort to assume the position. What you don't want to do is to assume that sitting position and be straining your knee into that twisting motion. If you have any problems, please use any height that you need. The higher, the easier it will be on your knees or your ankles, on your hips. The lower, the more challenging it will be. So that's a tip. Starting from the mermaid posture, what you can do to stretch the lateral aspect of your arm, your lower back, is then to use a leaning position. So you're going to hold your weight on the arm on top of your thigh, and then you're going to try to relax your body while this arm supports you straight. And then you're going just to try to do a side bending, taking your arm away, because that will create a little bit of more tension in the side muscles of your spine. So side bending there, and just to exhale to try to relax the rib cage, and then you would progress further towards that direction as much as you can. So your weight's being supported by that arm, this arm here. And then in here, you may start, look, reaching forward or reaching backwards with the arm to really search for the right spot to stretch. You may feel that in here, you stretch more that tender or stiff spot more than if you go in a neutral or a backwards position. So when you find that tight spot, make sure you focus a little bit more on there. And then to get an extra kick of the stretch, you just do a deeper exhale and hold that for maximum 2 exhales and come back. And if you want to repeat the dose, just because you want to work a little bit more, you felt some release or you targeted an area that's usually painful, then repeat 2 or 3 times, but don't stay too long, because otherwise you may have the opposite effect. Your muscles may cramp up or tense up, trying to hold you in that position instead of relaxing. So you just may have a harder time if you stay for too long there. Thank you.